Limb Loss and Limb Difference Awareness Month. Every day in the United States, someone loses a limb. Did you know that more than half of amputations are caused by vascular disease? That's one of the reasons April is Limb Loss and Limb Difference Awareness Month. We produce 5 amazing videos per week, so click on the like button and subscribe to see future videos. Like, comment, share, subscribe. A person can experience a traumatic amputation from a motor vehicle, occupational or industrial accident, or combat injury. Traumatic injury accounts for about 45% of all amputations. A body part can be cut off or torn away in a severe accident, or it can be so badly damaged from a crush injury or severe burns that it cannot be saved. Amputation is the loss or removal of a body part such as a finger, toe, hand, foot, arm, or leg. It can be a life-changing experience affecting your ability to move, work, interact with others, and maintain your independence. About 54% of all surgical amputations result from complications of vascular disease and other conditions that affect blood flow, such as diabetes and peripheral artery disease, PAD. Chronic vascular problems can lead to tissue death in toes, feet, and legs. If patients undergoing amputation for complications of these diseases, nearly half will die within 5 years of the amputation procedure. Removal of a hand, foot, arm, or leg to prevent the spread of certain types of cancer account for less than 2% of amputations. Cancers such as sarcomas can affect bone and soft tissue in the limbs, and if the cancer is too large or aggressive to be removed, if it is recurring, or if it extends into the nerves or blood vessels, amputation might be necessary. Severe sepsis is also called septicemia or blood poisoning. It happens when drug-resistant bacteria overwhelm the body and spread throughout the bloodstream. Sepsis can affect blood flow and cause tissue to die, especially in the toes, fingers, hands, and feet. Severe sepsis can be deadly if antibiotic medications cannot control the infection. What is congenital amputation? This is not a procedure, but a term that refers to a missing or incompletely formed hand, foot, arm, or leg that is present at birth. Children who are born with congenital amputations may undergo surgery later in life to be fitted with artificial limbs if the child, parents, and care team determine that such intervention might improve the child's function and well-being. The surgical approach depends on the affected body part, the reason for the amputation, and the extent of bone and tissue damage. A finger amputation may be a small but intricate procedure working with skin, tendons, and nerves to allow fine motor function and optimal use of the hand. The removal of an arm or leg can call for major surgery requiring skill in handling and stabilizing all the different tissues of the body part, including skin, blood vessels, muscles, nerves, tendons, and bone. To remove a finger, toe, foot, hand, arm, or leg, the surgeon may cut through the bone or detach, disarticulate a joint, separating bones where they meet, such as in the knee or elbow. The amputation may take place in stages. A revision procedure may be necessary to address tissue breakdown, chronic pain, scarring, or other health issues. Types of upper extremity amputation. Partial hand amputation, removing part of the hand. Wrist disarticulation, removing the hand after separating it from the lower arm at the wrist. Below the elbow amputation, removing part of the lower arm by cutting across the bones of the lower arm, the radius and ulna. Elbow disarticulation, removing the lower arm after separating it from the upper arm at the elbow. Above the elbow amputation, removing the lower arm, elbow, and part of the upper arm by cutting across the upper arm bone, the humerus. Shoulder disarticulation, removing the entire arm after separating it from the shoulder. Forequarter amputation, removing the arm and part of the shoulder. Shoulder bones could include the clavicle and scapula. Double amputation is removal of both hands, feet, arms, or legs.